Before taking a person's blood pressure, it is important to keep a few things in mind. First, make sure that your client has not consumed any caffeine as it may disturb the readings. Second, make sure they are in the proper position, seated with their arm flexed, typically their left arm, at about level with the heart. You will then make sure you select the proper blood pressure cuff size, not too loose, not too tight, and then you will place it on their bare arm and make sure that the arrow is lined up with the brachial artery, about an inch above the elbow. Also, make sure you take 3 to 5 minutes in between blood pressure readings. Next, you want to put on the stethoscope with it in the ears facing the correct position forward. You will take the base of the stethoscope and line it up with the brachial artery so that you can hear the pulses when you're taking the blood pressure. You will then take the bulb and make sure that it is closed by turning it all the way to the right so no air can escape from it as you are pumping. You will then pump the bulb and fill up with the cuff up with air to about 200 millimeters of mercury before you begin letting air out. To let out air, you will slightly turn the bulb to the left and let it air out at about 3 millimeters of mercury per second pace. You will then be listening for Korsakoff sounds, which are the noises of the pulse. The first loudest one that you hear will be the systolic blood pressure number, followed by some subsequent ones, and the last clear noise you hear will be the diastolic pressure. Your reading will always be an even number because they are increments of 2, so keep that in mind. 120/80 is the normal blood pressure. So if it's about that or over, it's pre-hypertensive, and if it is significantly over, it'll be hypertensive. My patient had a blood pressure of 118/68, so she was normotensive. And that is from the ACSM guidelines.